What? Audio's live? So I got to watch what I'm saying right now. 2, or is that victory? 1. Ready? You ready? Welcome to True Health Tuesday. And the truth will set you free. Biblical, and it's true. Okay, we're going to talk about, during this thing, about and headaches and migraines and what you could do about it. Okay, so we're going to give actual solutions. On the part that's totally censored, we're going to cover things that can't be talked about. Okay, and it's not just the COVID 1984. Okay, it's not the response to that. It's how healthy is our population? I mean, are you looking around, are you seeing just vibrant, healthy, amazing people? We're going to go over it at what the causative factor of that is. Now, we have to divide this up because of the censorship rules in our country and in the world, at least now, presenting information that's different against the narrative, even though it's from the CDC and everything else, it's a felony in some countries. So it will be eventually, but for now, we can keep it on Dr. B VIP. So if you're there, thank you for supporting us. Really appreciate it. And also, too, we got an event tomorrow night that's going to be on there, too. Is it going to be live on Dr. B VIP, Victor? Tomorrow? Yeah. Oh, bitchin'. Okay, good. Also, Extreme Health Academy, we're going to be putting all this stuff on there. And this one's got great forums. I did a 2-hour webinar a couple of weeks ago. So we're going to do that every month, and it's really interesting. But this is it. Okay, information that we can't talk about. Now, what's interesting, I've been on YouTube for a long time. I've been doing social media stuff for a long time. And there was never anything that you couldn't talk about. It's like I just saw Nike came out with this shoe. They're making 666 pairs. They have human blood in the sole and a pentagram on it. Okay, and I'm thinking, that I could talk about. Dr. Seuss, no green eggs and ham for you, young man. Okay, so tomorrow night we're going to talk at the Old World. It's located in Huntington Beach, right where we are. Billy DeMoss and me, I'm going to be speaking for about an hour. He's going to be speaking for an hour. But we're going to learn the truth about the rates, the disease rates, the vaccines, everything. And hopefully the police won't disrupt us, but it is going to be a bit powerful. And if they do disrupt it, let's make it peaceful. Okay, think about Gandhi and the sit-ins. Okay, so these guys are just doing their job and they're doing stupid friggin' rules. Okay, so, we're going to have a cool event tomorrow. Now, I was born in 1960. And at the time there was a Cold War, and there was a lot of challenges. We're just coming out of the war. Now, I've read this once before, months ago, but I want you to hear it now, just from the status of what we are. Now this is the president, okay, at his inauguration. We dare not forget today that we are heirs of the first revolution. Let the word go forth from this time and place to friend and foe alike, that the torch has been passed to a new generation of Americans, born in this century, tempered by war, disciplined by a hard and bitter peace, proud of our ancient heritage, and unwilling to witness or permit the slow undoing of those human rights to which this nation has always been committed, and to which we are committed today at home and around the world. Let every nation know, whether it wishes us well or ill, that we shall pay any price, bear any burden, meet any hardship, support any friend, oppose any foe, to assure the survival and success of liberty. This much we pledge and more. Could you imagine Dr. Seuss being eliminated in that type of culture? Okay, no. Let's get this back. Okay, this cancel culture bullshit, okay? We've got to get our freedoms back. And remember back when men were actually men? And I mean that, when you could say something and mean it, and say, I disagree with what you say, but I will defend to my death your right to say it. By God, that was a hell of a time. Let's get it back. Okay, we're the same Americans. Headaches and migraines. Facts. It's not for medication deficiency. Whoa! That's what my doctor says. I got a pain. He gets it. But pain negatively affects you. Nobody wants to hurt. But by God, treating a symptom without treating the cause doesn't make sense. 93% are coming from the neck. That means there's a problem with the neck. I'll show you how to identify it and correct it. About 7% are from toxicities, alcohol, drugs, environmental dehydration, super common. And 0.1%, 0.1%, are from tumors or other causes. Great example. 36-year-old gal with carpal tunnel syndrome. Now, carpal tunnel syndrome is a double crush injury, which means it's pinched nerve here, causing a muscle imbalance here. You know, we've got a couple of videos on how to correct that. But now, you're looking at her first x-ray on the left there. That's a reverse curve. That's bad with grade 2 arthritis. So that means that this gal, minimum of 10 years, ripped a ligament, the posterior longitudinal ligament in the neck, and she's been like this for at least 10 years, okay? She was into gymnastics. Anyone think she fell during gymnastics? Yeah, and so what's the therapy for that? No, I'm not going to respect that your body is giving you pain for a reason. I'm going to give you a medication to cover it up. Or if you're the coach, suck it up, buttercup, get back out there on the bar. Okay, none of that honors the body. What if we honor the body, that it's really intelligent? Then they couldn't figure out what the heck it was, so they put a ganglion nerve block on her, okay? So yeah, we're not going to look at because they would look, take an x-ray and see it's reversed. But without having the skill set to correct that, they don't know what to do. Drug, surgery, shot, okay? Thank God her headaches went away, got the curve back, and carpal tunnel went away. So let's look at the different headaches. And we're going to cover this in rough detail and then go over how to identify it. Sinus headaches. You got sinuses up here, behind the eyes, and down here. You got 6 of them. Now, if you see any kid that's 25 years old or under that's been fully vaccinated, they're going to have a pink hue to their skin, where if you touch it, it's going to turn white. And that means histamines. And how many people are eating non-organic bread? Okay, the non-organic bread typically is soaked in glyphosates, so it destroys the normal gut flora, allowing funguses and molds to take over. They bore holes in the intestinal tract, and that causes undigested proteins to leach in the system, creating histamine. So it's an excess histamines or hypersensitivity of the mucous membranes. How do you identify it? You put one hand on the front, one hand on the back, and apply a little bit of pressure. If this feels good, then you know that approximating or increasing the pressure, it's the sinuses are almost like trying to explode out. And I'll do this on almost every vaccine-damaged kid. And what you'll see dark circles around the eyes, poor sleep, stress, and low mineral absorption. And this one kid a few years ago, he was 10 years old then, now he's 17 now. And, you know, stoic kid. Was anyone in here ever a 10-year-old boy? Yeah, I know you guys. Okay, emotions, you don't want to show a lot of them, okay, unless you're with your buddies. Okay, does your head hurt, buddy? No, fine. Okay, nothing. And so I go up and I said, buddy, can I just squeeze your head? I'm just going to squeeze it just like this. Okay. So I squeeze it, and his face goes, oh. And you tell. Because if you've been hurting for so long and you've got nothing to compare to, this little kid was having impulse control issues, anxiety, stress, difficulty in paying attention, and the parents didn't want to put him on the amphetamines, okay, which is the Ritalin, because you give an amphetamine or an upper speed to a kid, it tends to calm them down. I know what you're thinking, speed to a 10-year-old might not be good long term, and you're right, it can cause kidney damage, adrenal fatigue, thyroid issues, and everything else. Now, migraines, 93% come from the neck. So you take an x-ray of the neck, and this is going to sound weird. If you see a deviation, you correct it. And then you take a post-x-ray to document the structural changes. I know, you're thinking, wow, that seems so simple. Okay, we're going to go over exercises for that. Standard headache, or at least, you know, over 90% of the time, it's the general headache. Eye strain headache, we're going to show how to correct that, but how many people are sitting at a desk reading or watching something that's just one distance? What that does, you've got muscles inside of the eye that constrict for close view and then dilate for looking further away because they got to open up to get more light coming in. So if your eyes are constantly constricted and they're not opening and closing there, the eye strain headache can be horrible, horrible. And I'll show you how to regenerate those muscles in a minute or less. I know, boy, I want to hear this one. Stress x-rays. You're going to find out the muscles that you got on either side of your spine, they're not under conscious control. So to deal with the physical, chemical, or emotional stress, we'll change those. Allergies, we're going to show you how to de-stress out the sinuses. Insomnia, lack of sleep, poisoning. So what are you looking at? Physical, chemical, and emotional stress. There's always a reason for the headaches. And if any doctor ever says that it's genetic or it runs in the family, that's when you break out the pepper spray, okay? Because it's not. Your body is intelligent. It gives symptoms for a reason. Great example. This is a referred trigger point headache. And what this is, there's going to be pain over the eye, okay, on the same side. Now, you can tell this guy's facing us, okay? So his head is massive laterally deviated to the right, right? Okay, is the body smart or smart? Okay, good. Like that. I'm going to give you one choice. Okay. Okay. Now, if we were at the period right before a test when I was teaching, okay, I'd say, okay, I'm going to give you guys the answers because you guys showed up. Okay. So if your body is like this and the body's smart, that means all of these muscles are going to be screaming to reposition it. Okay, does that make sense? Because if you're like this, you're going to have altered function, joints are going to deteriorate, everything else. And the body takes the muscles on either side of the spine that aren't under conscious control to move it over. And so this will be pain on one side, over one eye, on the top of the head, on the back of the head. And you'll see in between the shoulder and the neck area, right about halfway, there's going to be a golf ball of tissue. Okay, just in the back. Now, you can't go back like this. I mean, some people would be able to. But you take the opposite hand, put it up there, and pull down. And that'll knock it out. Or you can get the curve back. Now, even though his spine is off, okay, like in this position, once you put that curve back, the way the joints work is lifting the curve back, it goes back towards the midline. It's amazing. And I'll show you the exercises on that. But that's, again, before and after. So it's respecting your body, okay, that it gives symptoms for a reason. And that's to all the doctors out there, because it's tough. You got to figure these doctors, their protocols, they don't have a lot of time to diagnose lifestyle changes, big history or anything like that. Just know, doc, instead of giving a medication to cover up the symptom, do a little bit more detective work. Now, the postural muscles that run down either side of the spine aren't under conscious control. Now, you could, again, let's take that guy as an example. Could you massage those muscles? Yeah, absolutely. Okay. Do you want to? Wouldn't it be interesting to find out why the muscle's in spasm? Now, the muscles that run down either side of the spine going down to the sacrum, they're not under conscious control. So if my head is forward and off to the side, these muscles are going to be screaming to reposition that head. So you want to find out why the muscles are tight. Does that make more sense? Now, under any pain, and this is physical, chemical, or emotional pain, your automatic nervous system kicks up. So when somebody comes into our office complaining of headaches, sinus issues, bowel issues, had a couple of guys in today with reflux issues, really, really bad reflux. Okay, what do I ask them? How are their sleep patterns? How many bowel movements a day? Why? Because I'm looking for the autonomic dysfunction. Because if it's just reflux or it's just a hurt knee, they're going to have 2 to 3 bowel movements a day. They're going to be sleeping like a baby. And I'll say, wow, the autonomic nervous system isn't involved. I can concentrate on that area. Imagine that. Imagine if every doctor did that. Oh, you've had pain in your shoulder for years? What does that do? The fight or flight system kicks in. So that's resting, digesting, or repairing are not working well on you. So you got to do that detective work. So if you've had shoulder pain, carpal tunnel syndrome, hip pain, pain anywhere in the body, your body responds correctly. Okay, it's going to elevate high blood pressure or the blood pressure. It's going to elevate cholesterol. It's going to elevate blood sugar because those are a normal response. Okay, now here's one of the test questions I'd give for the anatomy. What's the connection between the hand and the eye? Okay, this all of a sudden would scare the heck out of most people. Okay, I don't know. Okay, so I pick somebody with light-colored eyes, and I go in between the index finger and thumb, and I go, okay, watch his eyes, watch his eye. I wouldn't do it to girls because it hurts a bit. I don't care if I'm hurting a guy. Okay, so you go 1, 2, 3, and you'd squeeze, and by gosh, you'd see the pupils open up. And that's what everyone would say. They go, whoa, that's kind of cool. Because what had just happened, okay, you squeeze that, the pupils dilate, but also the muscles on either side of the spine increased in tone. What happened to the heart rate? It went up. What happened to blood sugar? Blood sugar went up because the liver's starting to break glycogen down to glucose. What happened to digestion? Blood supply to the gut was shut down. And that was in that instant. And that's the cool part. So that's what I want the doctors to start doing, is to look at why the body is responding, not symptom drug. And in the Dr. B VIP, in the censored part, I'll show you why the system is like it is now. Okay, where it's symptom drug and there's not a lot of detective work. Psychological stress on lipid levels, that's cholesterol levels, and blood viscosity. It thickens up the blood. Because when you're in a stress state, that's physical, chemical, or emotional stress, the blood responds with that stress response, okay? It literally does thicken up the blood. And that's yucky blood on the left, decent blood on the right. A little bit too many cells on the right, but you know, it was a before and after. Headaches drugs can give you headaches. It's called a medication overuse headache or medication-induced headache. Now, it's mind-blowing because what happens if you look at the side of medications, the effects that those are designed for, they also cause the symptom. And this is like general. Like if you're taking opioids, within 5 days, your pain levels increase. If you're taking antidepressants, suicidal thoughts are a side effect or effect. If you're taking muscle relaxants, one of the effects of that is muscle spasms. When you're taking something for joint pain, like a non-steroidal anti-inflammatory, ibuprofen, Motrin, Aleve, okay, it destroys joints. And you might think, well, that really doesn't make sense, Doc. I know. But again, in the censored portion, we're going to explain why the system is laid out. Where you get a symptom, you get a therapy. Medication-induced mitochondrial damage and disease. So does that mean mitochondrial dysfunction was first described in the 60s? Now, mitochondria are little machines that live inside of your cells that produce ATP, and this is how your body, this is where the energy comes from. And if you damage those, you damage a lot. Okay, now damage to mitochondria understood now play a pathogenesis role in schizophrenia, bipolar, Alzheimer's, epilepsy, migraine, headaches, strokes, neuropathic pain, Parkinson's, ataxia, TIAs, cardiac issues, coronary disease issues, chronic fatigue. I mean, you're looking at all these different conditions from damage to the mitochondria. And medications now have emerged as a major cause of mitochondrial damage. So do we have a really healthy society, or do we have a very sick society? And I'm talking before 2020, okay, when people thought it was normal, and there's a couple of people standing on friggin' soapboxes saying, good God, our population is sick, okay? Before 2020, do we have a healthy population or a sick population? Sick, okay? And so what was the cause? And we're going to go over at why the system is like this, why you're not, vitally healthy. Now, antidepressants lead to brain bleed risk. Now, although antidepressants and non-steroidal anti-inflammatories are known to be associated with an increased risk of GI bleeding, it also increases brain bleeding. Now, affected 4,145,000 people. First hospital admission with intracranial hemorrhage within the first 30 days of drug use. Drug use, again, if the blood is supposed to be separate cells, and if you're under stress or taking medication, it starts to clump together. Under stress, does blood pressure go up or down? I know. See, give me the hint. I'm going to make it so easy. Okay, yeah. Okay, so it goes up, right, because the blood isn't efficient at doing its job. So that pressure has to go up to adapt to that. So if your blood cells are clumping together and the pressure increases and you've had, let's say, chronic stress, so you're not getting the protein broken down to amino acids, and you probably have a crappy diet too, so your blood vessels may be weakened. If you may be taking some blood thinners, okay, where you touch something and you get a bruise. Okay, you may have some other type of problem. Well, under stress, doesn't it make sense that if you're covering up pain, knowing that the pain will cause the blood to get thick, that it could increase damage or hemorrhaging of the brain? Absolutely it does. Deprescribing to reduce dementia. The average person over 60, okay, in America takes about 12 prescriptions a year. Okay, now they're talking about the massive rise in dementia. Okay, so deprescribing. Imagine that. Not prescribing. And I've got 3 medical doctors I work with down in our Mexico clinic. And I'm asking them, because we'll get patients in there. The worst I've ever seen is 32 prescriptions. But it's always in the 10s, 12s, teens that are coming in there. They're taking a sleep medication with the antidepressant, with the muscle relaxant, with the pain reliever, with the Norco, with the gabapentin, with just the plethora. And I'll say, hey guys, since you're the ones that prescribe this stuff, how do you get people off? There isn't any protocol. So what we have to do in the natural world is go over, well, actually what everybody should do if you're working on humans is find out why the drug was prescribed. Wow, God, what a concept. That hurt my brain. Doesn't that make sense? Like, why would you prescribe gabapentin for some type of neuropathic condition? What is neuropathy? Well, you can have neurotoxic stuff, you could have a compromised nerve supply, there's a lot of things. But it takes detective work and it takes the skill set to actually correct it. Now, these anticholinergic drugs, and these are going to be used for like allergies, asthma, things like that. They're also used for incontinence, asthma, dizziness, motion sickness, Parkinson's disease, all of those things. They lead to dementia. We have a number of different pharmacists as patients, and they wouldn't take that if you touch them with a 10-foot pole. Antihistamines linked to Alzheimer's. So does that mean that seasonal allergy that you have, that seasonal hypersensitivity of your mucous membranes? Because how many animals, other than the inbred creatures that we bred from wolves, those weird little dogs, okay, how many animals on our planet are allergic to their environment? None. None, because an allergy is an abnormal recognition of a foreign protein. Now, we're making a whole bunch of foreign proteins that our human body has never seen before, and we're destroying our gastrointestinal tract with, glyphosates and a bunch of other chemicals. But look at this, Excedrin PM, Nitol, Sominex. How many people do I get in here that say, look, I take a Tylenol PM to sleep, okay, so that way I don't hurt when I roll over. Okay, great, keep doing it for a few years and you won't even remember you hurt. I mean, no, let's respect each other. Okay, you're looking at before and after of a blood cell analysis, a live blood cell. You're looking at a reverse curve in a neck, a horrible reverse curve. Grade 3 arthritis, so you're looking at 15 to 20 years of damage in that neck. What do you think that her blood pressure was like? Normal, comfortable, nice. Her shoulders, chronic spasm, poor sleep patterns, all of this. I mean, you can go through and get a list of problems that she was experiencing, a list of them. I mean, just amazing stuff. Now, look at it, basic stuff. If you break down faster than you build up, you have a lack of ease. What did chiropractors call that? A dis-ease. If you build up faster than you break down, you have a thing called health. Okay? So what kind of things break it down? And I know you're saying, Berg, damn, slow down. Okay, I mean, it really is this simple. So what kind of things damage your nervous system and break you down? Well, vaccines, medication, MSG, glyphosates, pesticides, chemicals, Purell, sunscreen. I mean, things that are neurotoxic that damage your system, things that are endocrine disruptors, things that act like hormones that you've been exposed to. That new car smell, The blue masks that have the flame retardant in them, those things all break down your system. What builds it up? Oh my gosh, movement. Why? Because when you're symmetrically moving, you're stimulating that cerebellum, and then that affects the brain. It literally controls the frontal lobe. Healthy saturated fats, mental exercises, reading, aerobic exercise. You need at least a half hour of breathing heavy every day. Plant-based diet, deep sleep. It can't be that simple, but it is. So if you build up faster than you break down, you have health. If you break down faster than you build up, you have a lack of ease. I mean, just look at your body. If you're suffering from type 2 diabetes, which is 95%, if you have high blood pressure and high cholesterol, those three conditions that you have are not diseases. They're adaptations to stress. Migraines linked to heavy metal poisoning. Obviously, I mean, if you're looking at a population, if you're 25 years old down to 18 in that age group, you've had 72 doses of 17 different vaccines. If you're on the adult schedule, you're going to have 13 to 15 different vaccines. And I'm not even talking about the experimental gene-altering procedure or machine, because it's not really, it's approved by emergency youth authorization, the C-19. You know, and there's a number of different things that we can't talk about on this, but we're going to talk about in the Dr. B VIP. But just think about it. Most of those injections, not the C-19 one, but they have heavy metals in them. It's just crazy. So eye strain headache, here's the quick trick. This is for everybody that's ever had eye strain. So I'm going to show you how to do it. What you want to do is cover your eyes and make it super, super dark so you can't see anything. And then with your eyes covered, yeah, I actually pointed to somebody that wasn't doing it. And I'm staring at other people that aren't doing it. Okay, so you keep your eyes covered as dark as you can. Okay, then open your eyes and try and focus in to see the inside of your hand. By focusing in, you relax those intrinsic muscles, your pupils dilate, and raise your hand if you felt the eyeballs relax. Isn't that a trip? I know. Now, to relax the skeletal muscle can take a few hours to a day. To relax the smooth muscles, you can replenish them in about a minute. Okay? Isn't that cool? 30 seconds to a minute, you do that, and it literally refreshes your eyes. You can also have a loss of curve in the neck. Restored curve in the neck. And, I can't this is not beating a dead horse. Just know, what kind of symptoms is this person with the neck going to have? High blood pressure, high stress, joint pain because they're in their pain and the blood gets thick and it can't filter out through the joints. Okay, does that make sense? You got to find the cause. Sinus headaches. How do you identify it? You squeeze a little bit up front, a little bit on the back. If that feels better, it means the sinuses are breaking out. What's another sign? You touch your skin. If it turns white where you touch it, that's excess histamines. It's not a sinus issue. It's a sinus alarm. It's not an eye issue. It's an eye alarm. Does that make sense? It's not a headache. It's a headache alarm telling you that there's some kind of problem somewhere. Now, if you have inflammatory bowel disease, or if you've been eating commercially produced bread products, your intestinal tract is going to be leaky. You're going to have the mold growing in there. And this is going to bore holes in the intestinal tract so they have undigested proteins. So this makes you sensitive to certain things, like gluten, casings, okay, all of those things. So this is where a lot of allergies or hypersensitivities come from. So you got to heal the gut. When we're talking sinuses, heal the gut. That's 80% of the immune system. Get adjusted, restore the nerve supply to it. Spicy foods are amazing. Like cayenne pepper, it's a vasodilator and it's loaded so it opens up the blood vessels. Thins out mucus, okay? And it's also loaded with vitamin C. Pineapple, bromelain in there. I mean, literally, fresh fruit, fresh smoothies, that will decrease the inflammatory response. And water. How many people do not drink enough water? Okay, this right here, a really good friend made, it's coconut water with turmeric. I know it's my fast day, but it's still pretty darn good. Okay, so it's a venial sin. Again, before, after, but now when you're looking at this, see the metal teeth? Okay, what is that? Those are root canals. Those are implants. Those are foreign objects embedded into the bone. You're seeing a little bit of discoloration around the outside, so that's a demineralization of the bone. Okay, this is a dangerous, dangerous thing. She may have cavitations. There may be a lot of problems there, so that's got to be addressed. Now, when you have a loss of curve, we make a thing called a TheraCurve, where you just literally pull it down, lift your chin up, look straight ahead and relax. Chin to the ceiling, straight ahead. You could do this with a towel. You could do this with a t-shirt. Why do you pull it down? Because normally, when your neck has been traumatized, guess what? You're not going to be moving the neck. I get patients all the time. Doc, my neck hurt the other day. It feels fine now. Doesn't hurt at all. I say, look, Frank Einstein. Okay, no. Pull it down, and then just about 1 kilo of pressure, about 2 pounds, and look up, not back. And I have seen everybody do this every way you could possibly imagine. I demonstrated, unless there's some kind of surgery or something, we're talking 90%, 95% of people are going to put their hands to the chest, pull down, and point their chin up and look straight ahead and relax. That's about 90%. Had this one nurse come in. She says, Doc, I can't do that exercise. It gave me a headache. And well, how are you doing it? Do it just the way you told me. Just the way you told me. Just like this. And I go, holy shit. So what do you do as a doctor? Okay, that's not what I meant to show you. It was my fault, okay? I need to be more clear when I explain this, okay? So you demonstrate, and it's just like a turtle looking out of their shell. Or when we do this with little kids or people that are office work, put your elbows on a counter, lift your chin up, and nasal breathe. Why nasal breathe? Because that vasodilates and bronchodilates, so it opens up the air tubes and the blood vessels. And you're lifting up, not back. That lifting up will start to restore the curve. And this takes a huge amount of pressure off of the neck. Why? Because loss of curve in the neck, restored curve in the neck. Have you ever seen this before? Yes! I've got thousands of them. Okay? Because at 30 adjustments, we take another one. So it's not like, wow, that's the one patient. No, we have to show a change. If we're not correcting the structural and neurologic deficits, we're not doing our friggin' job. So imagine if you held every doctor to that level of accountability. Okay, doc, you just told me I have high blood pressure. What's the cause? Here it is, hydrochlorothiazide. That's going to be... No, doc, what's the cause? Here it is, an ACE inhibitor. No, doc, what's the cause? Beta blocker. Doc, are you telling me that it's a deficiency of medication? That's why my blood pressure is high? Because right now, with you talking to me, my blood pressure is going up. Okay? The Arc of Life. My boat's name is literally the Arc, Advanced Restorative Clinic. Okay? That curve in the neck is everything. If you get one thing out of this talk, by gosh, get that neck curve back. Because it is everything. You're talking headaches, respiration, diaphragmatic function, hiatal hernia, asthma, breathing issues. It is called the Arc of Life, and 100% of people with Parkinson's that I have seen over 23 friggin' years has got loss of curve in the neck. I mean, how long has that been going on for with some of these people? You're looking at 30, 40 years of damage. Okay, let's just fix it. Cayenne, it can't be that simple. But Cayenne, look at the book, and this is a failed bypass surgery operation book. Left for Dead. Brilliant. But cayenne pepper vasodilates, okay, and it literally is loaded with vitamin C. So you open up those blood vessels, you get it working better. Now, so how do you do this? You address the physical, chemical, and emotional stress. What do we look at if somebody comes in with foot pain? Physical, chemical, emotional stress. What do we come in if somebody has knee pain? Physical, chemical, emotional stress. What do we look when somebody has pelvic dysfunction or pudendal nerve problems? We're going to look at the physical, chemical, emotional stress. Why? Because every human body is suffering from one of those three. They might be an organic vegetarian that does juicing and blending with crappy sleep. Guess what lack of sleep is? That's a chemical stressor. Okay, they might have anxiety and stress. What does that do? That fires off the muscles on the back. Okay, so that means that they're going to be stiff, an altered function of the cerebellum controlling the frontal lobe. You have to address all three of these no matter what condition you have. Does that make sense? Yes or yes? Good God, it should. Now, normally, Victor, I'd tell him to stop the feed, but this is where normally we would stop the feed and then we'd talk about the materials that the government would find offensive. But I want to bring this up again, please, if you can. And if you are going to be at the Old World 6:30 to 8:30 tomorrow to see our information, we're going to have some food there, all the donations, and it's free if you can't afford anything. If you want to donate $5 or $10 or $20, it all goes to the Children's Health Defense. Okay, so that we can help Robert Kennedy in his fight. So please call our office for any details. We're probably going to do more of these events coming up because I think social media is going down. Now, Victor, if you want, you can stop the feed because this is the part that I can't really share. But I thought this would be a comedic, huh? Do I got to wave goodbye? Oh, which one? Am I waving goodbye still? Okay, cool.